with the present condition of the world, receiving medical attention physically is becoming riskier with the presence of the pandemic, and thus conducting normal daily activities have a slighter risk to them. When it comes to dentistry, dental malocclusions are a very common occurrence throughout the world. Since knowledge about dental malocclusions are very little for the general public, people can be a bit hesitant or unknowledgeable for when to visit the dentist when this kind of occurrence happens. Usually, a dental malocclusion is diagnosed by a dentist physically. In that case, here is where image processing can come in. Image processing has been one of the areas that have been thriving throughout the past few years, especially in the medical field. And therefore, this research attempts to use image processing in order to detect and classify dental malocclusions. In the present, there have been a few researchers that have incorporated image processing in dentistry. With the use of medical imaging technology, various attempts on various types of dental issues have been tried to be experimented on. As one of the older researchers that directly correlates to malocclusions, in 2014, there was a research conducted in the name of automatic feature identification in dental meshes. Here they have used a specially made laser scanning device in order to scan a patient's teeth. In this research, they have used clay meshes of patients' teeth and used specially made laser scanning devices in order to scan these clay meshes. And with those scans, they have created 3D models of the teeth. Another research was conducted in the year 2020 named Teeth Detection and Dental Problem Classification in Panoramic X-ray Images using Deep Learning and Image Processing Techniques. In this research, they have used panoramic X-ray images along with a few methods of image processing. They have proposed an original CNN and compared it with a few other models such as YOLO algorithm. There also have been other similar dental researchers that have used X-ray images such as detection, age and gender with developed a novel algorithm in image processing technologies by implementing to dental X-ray images. As such, similar researchers exist that have been using X-ray images as their choice of data for image processing. Another research that was conducted on dental caries was in 2019 in the name of detecting smooth surface dental caries in frontal teeth in image processing. They have used normal dental images of patients with dental caries in as their data. They have used MATLAB in order to classify and identify dental caries with two classifying types of classifiers, being SVM and the method of decision tree. From all of the noted researchers, they have been all conducted by collaboration with medical professionals and not for the purpose of the use of dental patients. Even if we provide a solution for the general public to use to detect dental malocclusions, the issue comes where what type of data must they present in order to do such a detection. Therefore, using regular digital images comes into play here. As such, this research attempts to identify dental malocclusions using normal digital images The following architecture diagram will be used to explain the presented solution. This diagram represents the malocclusion detection system. It contains three tiers of the presentation tier, the logic tier, and the database tier. The presentation tier includes the user interface. This is where the user may enter the relevant information and the image in question. After the user submits this information, it will be transferred by the REST API to the backend, and the backend then will import this image and the information into the malocclusion detection model. The model will be used to detect if the image contains a malocclusion or not. And after this process is completed, an image, the results will come as the output. The results will be saved in the database tier as the history of the application, and this tier will also contain other application metadata. So after the malocclusion detection is completed in the logic tier, the backend then will use it in detection analysis in order to give the user a well-structured report of the outcome. This segment will be showing the implementation of the prototype. So we will be using YOLO 5 algorithm for this. First off, we will be looking at the data set. If we look at the train data folder here, we have two folders named images and labels. Images have, if we go to the images folder, we have two set of folders. One folder is set as a train, which has all the data and images that we'll be using for the training segment. And then we have the validations folder where we'll be using these images to validate the coming output. And if we go to the labels folder, the labels folder will contain all the annotations related to the above mentioned images folder. If we take a look at them, they will contain the parameters such as this. This contains the class name, the class label, and the parameters for the bounding boxes. If we move on to the data YML, here you will be able to see the directory set for the train data and the validation data here. Here we'll be also naming the amount of classes we'll be running the system on, and the name of those classes. Here we'll be using these two classes here, and here by running this prompt on our command prompt, we will be able to run the system for the corresponding data we have selected, and initialized classes and all that. After executing the command, we will be able to see the creation of the model as such. As of the present, the created YOLO algorithm model only supports two types of malocclusion classes. In the future, we will attempt to improve and therefore will be able to detect multiple types of these classes. In addition, improving non-functional requirements such as accuracy will take some priority in future development.